seeing patients isn't the ultimate of nursing. I mean, it's a huge part of our profession, but that doesn't make you a nurse. What makes you a nurse is your thinking and your context and your ethical obligation to the profession and to the public. And I think just reframing ourselves as thinking that bedside is the ultimate expression of nursing, I think that's an old school sort of viewpoint. And I think we need to take the mindset of nursing is a skill set that can be applied almost to any industry in the world.
Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. Today, we're joined by Dr. Dan Weberg, whose career exemplifies the transformative power of nursing and healthcare innovation. From executive leadership roles at major healthcare organizations to spearheading clinical innovation initiatives, Dan has been at the forefront of healthcare transformation over the past decade. He's an accomplished author, speaker, educator, and thought leader, serving as faculty at the Ohio State University's College of Nursing Innovation Master's Program and vice president of the American Nurses Association, California. With a PhD in healthcare innovation leadership and extensive experience in workforce development, Dan brings unique insights into how nurses can shape the future of healthcare. Today, we'll explore innovation in healthcare, non-traditional paths for nurses, and how nurses can lead meaningful change in our healthcare system. Dan, welcome to Nursing Beyond the Bedside.
Thanks for having me, Audrey. This is great. And I've definitely taken a non-traditional path in nursing, so I'm excited to chat about it.
Yes, you have. And so really, I want to start back in your early days of nursing. What drew you to the profession initially? And was it always on your mind that you would look to go beyond the bedside?
No, I thought, well, it started back my freshman year of college. I was sitting in my dorm room. I was a business major at Arizona State, and I went through my macroeconomics class, and I was like, this is not, I do not want to live in a cubicle the rest of my life, and I don't understand these things. And so it just wasn't speaking to my soul. So while my friends went off to Mexico for spring break, I actually stayed back in the dorms and looked through, and it's like, well, I got to figure out where I'm headed next, and ended up choosing to go pre-med. And then I talked with all the pre-med advisors, like, hey, not everyone gets to medical school. You should have a backup. And most people had backups in like biology or teaching or something. And I was like, oh, nursing sounds good. I have no idea what nurses do, but this sounds great. Still in the healthcare field, and ended up doing a lot of the pre-med classes and just didn't resonate with that culture and that sort of type A gunner sort of thing that goes on with the medical school people, and sort of ended up sort of dropping those classes and sticking with nursing, and got in and just fell in love with it. And so it was a sort of happy accident. I'd done some volunteering and things in different migrant health initiatives in hospitals and things. So I got a flavor of what was going on and just got in nursing school and was like, this is my spot.
That's amazing. And what were some of the things that you loved about it?
I think the flexibility for me is huge. I like to say I have self-diagnosed ADHD. So and I'm an ER nurse. And so I think that goes hand in hand. Being able to not be stuck in something forever, and you go into med school, your specialty is your life for the rest of your life. And nursing, you can bounce around. And I ended up finding a home in the ER. I started as an ER new grad, and just that, I don't think I could work anywhere else. That spoke to my soul. I loved it. I was good at it and really enjoyed doing the bedside stuff. And then, just through mentorship, got exposed to other things, and including simulation. So the mannequin work was one of the first things I got into in nursing school, actually, that branched me out and saw the sort of the different aspects of healthcare that you could get into as a nurse.
Yeah, so I was going to ask you about that because, you have that initial bedside experience. And I think that, down the kind of straight and narrow nursing path, we don't necessarily get exposure to a lot of other things other than just clinical hands-on with patients work. So beyond, I guess, like, it sounds like the mannequin work and like sim lab was like kind of your first thing.
Mhm.
How did you then like continue to evolve and to find these like innovation type roles?
Yeah, so simulation was a big catalyst to it. So when I was going through nursing school, our school had just bought sim man, and it was in a box in the closet, and none of the faculty knew how to use it. And so we had a very forward-thinking faculty member who was like, "Hey, we have, every senior nursing student had to do a project." And so they're like, "Hey, we need two nursing students to work on sim man as their project." And I was like, "Oh, that sounds great. I'll go do that." And so I basically locked myself in a closet with sim man and figured out how to program him. And I created Coder Johnson, the first ACLS simulation that we had at ASU. And the faculty loved it. And they're like, "Hey, we don't know how to do this. Can you teach us how to do it?" And so I was like, "Yeah, but I'm going off to new grad land. Like, I'm going to UCLA. I'm leaving." They ended up writing a position for me to come back. And so I helped teach them how to do simulation. And then that's sort of where I was like, "Oh, I'm going to start building a simulator. Like, I'll get some consulting gigs out of this. This sounds awesome. Like, there's a whole side gig going on here." And so I joined the Masters in Healthcare Innovation program thinking I was going to build a simulator. And I've quickly found out it was a leadership degree, not a simulation product development sort of degree. But I embraced it and loved it. And that's where I got exposed to Tim Porter Grady and some of these really iconic Bernadette Melnick, like some really iconic nurse leaders that we all read their books. And they became my mentors. And they were like, "Hey, Dan, there's more to this." So, I was working full time at the bedside doing all this stuff because I thought that was really important. But I started slowly getting exposed to the world outside the healthcare system as a whole and how broken it was, and really realizing that nursing can lead the change that we want to see.
Yeah. And so I feel like a lot of nurses listening may feel like healthcare innovation is kind of a buzzword. Like, how would you break that down and describe what that is?
Yeah, I mean, it's really just influencing change, dramatic change in where you are. So I think a lot of people think it's starting a business or creating a technology, but there's innovations you can do at the bedside. I had no power as a new grad. You're the lowest person on the totem pole, and I was the first. I brought in like the Palm Pilot 3 with Hippocrates on it, to do drug reference. We stopped using the stupid book because I was frustrated with it. And the nurse is like, "Oh, what are you doing over there? How come you know what the residents want right away?" I was like, "Well, it's on this stupid little thing. Like, if you want to try it," and they all went out and bought one. So that, like that's the kind of stuff I was doing. And that was innovative at the time. Like that people were still using the drug books. And so I think, it really is looking at the problems you have in your day-to-day work and trying to figure out solutions that you can influence on. That's all the way from small things like bringing the Palm Pilot in, all the way through big initiatives or starting a company. I think nurses can really, they understand how the healthcare system works because they're at the center of it. And so using
Mhm.
that to be able to problem solve and then create solutions, whether they're businesses or inside your organization, I think really is what innovation is.
That's a perfect breakdown because I feel like innovation can feel like it is this big flashy thing that is kind of out of reach to your like normal bedside nurse. And
Mhm.
so, yeah, I think that the way you laid it out with just like creating change, like creating solutions, I think is really important for nurses to understand. You mentioned the power of getting connected with important mentors in your life that kind of like helped you down this new path. And mentorship is so important, whether it is at the bedside or like pivoting into something a bit different. But can you talk to us a little bit more about how like mentorship played a role in you kind of like going down the path that you've taken and what some of like the key steps that you were able to take to like start building your own brand and establishing your
Mhm.
voice in this space?
Yeah, I think mentorship has been the single biggest catalyst to my career. And I was lucky enough in my programs to connect with some really great leaders that, were willing to take me under their wing, and I poked them a lot. I mean, I remember Facebook posts back during my dissertation days where I really pissed them off. Relating writing a dissertation to getting a colonoscopy or something like that, and then my faculty calling me the next day saying, "Dan, what the hell are you doing?" But I think that it's just being real with them and just really absorbing what they had to say and saying yes to when they challenged me, not getting defensive about it. And they opened up so many doors. I remember walking into Bern Melnick, her office when she was the dean at ASU, and saying, "Hey, we need to do a leadership mentorship program for our undergrad students." And she's like, "Dan, this is a crazy idea. What do you mean? I don't know you. You don't know me. Like, what are you talking about?" I was like, "Well, let's figure it out." And she was open to that. And then that opened up all kinds of doors, just having that collegial relationship
Mhm.
with Bern. And so I think it was just sort of like creating value for each other, finding those people that sort of speak to your soul and saying, "Hey, let's figure out how we can work together in little ways." And it just sort of grew from there.
I think that an important piece of what I heard from what you're saying is kind of having like the go getter attitude or like the confidence in your own ideas. Because I think a lot of times we can like think of an idea or think that like something sounds really great, but like not actually take any step to go and do it.
Hmm.
And so I think that that is a big differentiator in the nurses who are able to like really go and do something and innovate because they break through that, like, oh, yeah, it's a great idea. Sounds great. Hopefully somebody else will do this.
And I failed my way through it, Audrey. I mean, I had no idea what the heck I was doing. I was a senior nursing student trying to like do something with the dean. I had no idea, like, and I fell flat on my face so many times. But it's just like if I don't, if I don't at least try and even have sort of this, ignorance about it, like no one's gonna do it. And I'm the type that I don't want to live in frustration. And so at least trying to do something, and sometimes it worked, sometimes it didn't. But more often, saying yes to something really led to awesome opportunities.
I'm so glad that you just said that because I think that fear of failure holds so many back. And it is like a scary thing. Like we all have a bit of pride and we're coming from this like bedside environment where failure is like a really bad and often like dangerous thing.
Mhm.
So we as nurses working at the bedside, we feel like we need to be very sure of what we're doing and what the next steps are and like all of these things so that we don't make like a dangerous mistake. But I think that what's important to realize is that when you are innovating or if you're like trying a new career path, like whatever it is, when like that direct patient care is not involved, the stakes are so much lower and you're like
Yep.
almost expected to fail and like learn from that failure in order to like figure out the next thing that might work.
Yeah. No, I totally agree. I tell people all the time, I never had a career plan. Like, I didn't go into nursing saying, I'm going to do this for a few years, then go be management, and then go be a CNO, and then do innovation. And like, I didn't have that plan. I was excited just to be an ER nurse. I thought that's where I was going to spend the rest of my days until I got exposed to something different. I was like, oh, well, I love this simulation and this education thing. And then I applied for a random role at Arizona State and got it. And then I got more into like the academic side. And I was like, oh, I don't really like the academic side. I want to go back to practice. And there was an opportunity with practice. And like, it just sort of, as opportunities came along, instead of saying, well, I'm not qualified or I'm not good enough or I don't have that yet, I don't have the degrees or whatever. It was like, well, why not? Let's see where
Hmm.
where this goes. And I knew enough I knew enough to be dangerous. And then I had great people around me that could help support and fill in the gaps and just continue to learn. And that's been my entire career. So
Hmm.
I did know though, and I know this is a thing that a lot of the nurses think. They think, well, I have to go through management or I have to go be an NP. Like those are my two ways out of being at the bedside.
Right.
And I was like, I don't want to do either one of those. And so what are the jobs around that? And I did everything but pure operations. I did education, innovation, technology, now back to education. Like I didn't have to go through the management ranks. That was not my passion. And I knew I would not be good at it. And so I think that was the clearest sort of North Star in my head. And the rest of it, just tried to figure out how to say yes to get around that piece.
Yeah, definitely. And I think that recognizing that your career does not need to take like any set path, like no one's writing the rules on what your career needs to look like. So I
Mhm.
think that like recognizing like what it is that you like doing, like what you can kind of slide into, what opportunities you can say yes to is really important. And I want to talk more about like some of the opportunities that you see for nurses today to like innovate or create change. What do you think? Like, where's a good place to start?
And I mean, there's so much more opportunity than when I started this stuff. And I've been a nurse for 20 years. So I feel like that makes me feel old, but like it's not that long, and there wasn't all these resources. There wasn't entire associations dedicated to innovation. Like ANA was not talking about innovation at that time. There's nothing out there. There weren't all these job boards with like remote work and all that kind of stuff. Like there's so many things out there nurses can look for. And I think so. I think there's tons of jobs out there that you can do. I think it's more important to figure out what makes you happy and
Mhm.
how can you translate your passion in nursing into something else if you don't want to stay in where you're at. And I always, I sort of look at my career as three things. I always have three things going on. I have like my day job, I have like a side job, and then I have some passion project I'm working on. And those are sort of I always have those three things going. So if the day job like doesn't work out or, is frustrating, I can shift energy around to those different things. And there's always a door that's open in one of those areas. And so not just throwing everything into one basket, I think is really important. And for nurses, you can do that working 3 days a week. You can pick up so many different
Mhm.
side gigs and that kind of stuff. And I would just say, get out there and figure out where you want to go. If it's tech, there's lots of resources to go into tech. If it's, remote jobs, there's entire nurses posting job boards with not non-traditional roles. If it's academia, there's some cool stuff going on in education right now. And I think you just got to find that niche and then go look for resources in that space.
And you said there are a ton of opportunities out there today, and I completely agree with you. I think that what I found that's a little bit different about like my perspective now versus my perspective at the bedside is when I was working at the bedside within a healthcare system, it sometimes felt like change was very slow, almost non-existent.
Mhm.
Versus like now when I'm working in like health tech roles, change is constant.
Yeah.
Like there's always something new. How do you kind of think about that like gap in what we experience in that world like away from the bedside and what we actually see like happening at the bedside?
Yeah, I mean, I think it feels accelerated when you're in a like a tech, especially a startup space. So I worked for a startup for 2 years, and it was a big pace change. Like we were making decisions in the moment and implementing 5 minutes later, which doesn't happen in healthcare any time ever.
No.
But I think it could. I think, just we're just so slow within our systems. But yeah, you think there's a pace change? I think the biggest thing that nurses do is they undersell themselves, I think. And so, they look at like these tech jobs. Well, I don't know how to code. It doesn't matter. Like your knowledge as a clinician and just understanding the workflow of nurses is insanely valuable. There are
Yes.
companies that will pay you $500 an hour just to talk to you about what a nurse does in their day. Like there's
Yeah.
lots of things out there. And so I think just saying, I'm an ER nurse. That translates into rapid decision making, high stress environment, super knowledgeable, and making critical decisions very quickly. Like that is every company's dream employee. And so I think just trying to translate those things, not being afraid of it, and jumping in with both feet. I mean, and I've been fired from jobs. I've been laid off from jobs. Like, don't worry about that future. If it's exciting and it's something you're passionate about, jump in and try it out. There's thousands of nursing jobs out there. The best thing about being a nurse is you're never going to be unemployed.
Yeah, that's very true. Even if you go and like try something totally new, if that doesn't work out, you can always come back to the bedside,
Yeah.
like you always have that like built-in safety net. And like you mentioned a few minutes ago, like if you want to try doing something else like on the side on those 4 days a week that you're not at the hospital, like great, you have the perfect opportunity for that.
Mhm.
And you mentioned like nurses recognizing their value, and that comes up again and again on this podcast. And I'm so glad it does because I think that like when you're so in it at the bedside, it's hard to really recognize how your skills and experience translate. Like, I mean, I used to think like I can't go do this because I would need a different degree or I
Mhm.
would need to know how to code or I would need this and that. And it's like, no, like you already have so many valuable transferable skills that go into all types of roles. And beyond that, like you just mentioned, this experience of actually living within the healthcare ecosystem and like truly understanding those systems from like the interdisciplinary teams to like administration to the patient experience. Like nurses have this like very unique experiential knowledge that really I don't know that you can like fully get to the extent that nurses have it without actually like working boots on the ground
Yeah.
in healthcare. And that's valuable.
Yeah, and I mean, look at all the AI companies now, right? They're reducing the number of software engineers because AI can code accurately for a lot of things, but they have zero clue about the workflow of healthcare organizations. I
Mm.
mean, they need more nursing. Nurses hold this valuable information. They could catalyze this entire revolution of tech-enabled care just because you know how all the pieces fit together. Physicians, for the most part, know one thing. They're kind of in one workflow, and our therapists are in one workflow, but nurses connect the dots between family, physicians,
Mhm.
therapies, discharge, home, all of these pieces. Like we understand the whole system, and there's a lot of value in that. And so own that and go out and find stuff that's fun and cool and go say yes.
Yeah, definitely. And I'm glad that you brought up AI because I feel like that is something that I've had a lot of nurses say that they are like worried about AI coming to take their job. My response to that is AI is coming to give you back the parts of your job that you love by
Mhm.
taking away all of those things that you don't like.
Yep.
So, talk to me a little bit about like what you've experienced in conversations with like whether it be nurses or like healthcare administrators about AI in healthcare and, like, how they're thinking about that.
Yeah, there's actually a paper that was just published by Olga Yogasheva, who's a nurse economist. She's not a nurse, but she studies nurses and healthcare economics. And she published a paper on the skills of nurses and what could be replaced by AI. And none of it is the stuff that nurses care about: the delivering medication, the caring for a patient, the coordination of care. Like none of that stuff is going to go away. The assessment, like anytime soon. The stuff that's going to go away is all the stuff nurses hate: documentation burden, checking boxes on electronic medical records, referencing evidence-based practice. Like all of that stuff's going to be enabled by AI. So it's going to actually give you a superpower. And I didn't do a study. Actually, one of my mentors, Marilyn Chow, did a study in 2009 and found about 30% of a nurse's day is wasted in hunting and gathering information and people. And like that's a 4 hours out of a 4 hour shift. If you could get 4 hours back in your shift, now you can take a break. You can talk to your patients. You can go to
Uh-huh.
the bathroom. Like that's the stuff I think AI can take away now. And then the rest of the stuff is it possibly we could be cared for by robots in the future, but it's not going to happen anytime soon. And so I don't think we need to be afraid of replacement. I do think we need to be open to replacing the stuff that's not nursing specific, like the tasks and stuff we do that just don't need a nurse's brain. That's what we should give up. And we can then focus back on what's really valuable, which is the care and the coordination.
hmm And this goes back to how nurses can work with like companies, like consult with companies to give them this like insight into what the day to day like experiences and workflow is actually like.
Mhm.
I feel like part of the resistance that nurses are giving to AI comes from a history of kind of being like handed a change that doesn't work for them and
Yeah.
saying, here you go, make it work.
Hmm.
And that adds like more friction to that nurse's day. And so I think that like the shift of the narrative that like is possible to happen here and like what's happening is like nurses are being asked, like these health tech companies are asking nurses, they are opening roles for nurses, they want to know. So this is like a really exciting time for that to shift, so that instead of nurses being handed this thing and saying, hey, figure it out how to make this work, this is going to be great, and it's not great, they get to play a part in what that is, so that when it is delivered to them, they're like, "Okay, yeah, this is actually great. Nurses were involved in, like, how this was developed, so, like, this does work for me." And I think that's exciting.
I think it's exciting too. And I think, the early tech companies that were trying to come into healthcare with AI also didn't do themselves a good service. There was, headlines, nurses are being replaced for $9 an hour with AI. And that, there's companies that call it AI, buy your AI nurse assistant kind of thing. And like, so that, they sort of didn't understand the impact of that or the legality of a protected title like a nurse. And so
Mhm.
they're starting to backtrack. I'm seeing it on social now. They're starting to backtrack some of those titles and things. And so, but that makes people afraid. Like, you don't come in here and like, hey, see this is the replacement for firefighters. Of course, the firefighters gonna be mad about it. Like you're attacking people's livelihood. It really is. It really is an assistant or a superpower that we could have. And I think that's what we have to look at it as. And we have to be involved. We can't passively wait for the next thing. And you got to jump in and say, this is what I like, this is what I don't like, and let's move forward together. If we're not at the table, they will start replacing our work. But I think if we can show the value that it can have to really create better care outcomes, there's entire companies dedicated to making nurses' lives easier.
Mhm. Yeah. And so this is happening. Like AI is coming to the healthcare space. It's already there. So how do you see the role of nurses evolving? Like we can even look out over the next like 10 years. Like, is this robot nurse something that we're going to see in the next decade, you think? Like what do you think the next 10 years looks like?
Yeah, I really think it's going to be nurses working more at the top of their license and having the information, customized, personalized information they need in real time. So, instead of wheeling into the hospital room with the workstation on wheels and staring at the computer and typing, you're going to be able to walk in and do a verbal assessment with your patient, and it's all going to be charted. Like, I mean, that I think that's the sort of dream for that interaction, right? You can just be
Mhm.
you with your patients and have it automatically charted. So I think that's a huge chunk of piece of the work that's going to change. And I do think there's going to be robots, but I don't think they're going to be doing nursing stuff. They're going to be bringing you things. And that's already happening with like diligent robotics. Like they'll bring you the admission kit, they'll remove the dirty linens, like they'll move out the trash for you, like all the things that nurses do on the side that doesn't require nursing brains. That's what those things can automate. And it's already happening. I think the last piece is if you think about how healthcare happens, it's very archaic. Like we wheel that stupid that vital sign machine into the room and strap people into things and hope that we get the right vital sign that minute. There, with AI and what Google's doing, you can do a retinal scan and get almost an entire medical history out of a retinal scan, including their vital signs and cardiovascular risk. And so instead of wheeling these sort of chunky, clunky things around in the hospital, we can actually walk in with a retinal scan and get all their vitals in a few seconds, get some data, tie that back to their history, have real-time information that we can share with the patient family. Like I think our lives are going to be so much better. Nurses are going to love nursing again. That's the dream, I think. But we have to
Mhm.
be able to design that because many people don't understand what nurses do. And unless we're there, it's not going to happen.
Finally someone to go get the turkey sandwiches and the warm blankets that I always
Exactly.
forgot about.
And the frozen like juice things out of the fridge just because I'm so hungry and this is like the only thing there and some crackers. That's my lunch. Yeah. That we'll have
Yeah.
someone bring that to us instead.
Yeah, exactly. And I think that you also said something important there about people don't understand what nurses do. And
Mhm.
I think that like that exactly is something important to keep in mind when we as nurses are hearing these things about like, oh, an AI nurse or whatever. Like, I think that it's important to hear that and kind of just like recognize that most people don't truly understand everything that's involved in what a nurse does every
Mhm.
day. And so I think that like we can, instead of just like immediately shutting down that conversation of like no AI nurses, like maybe open the discussion of like why a robot can't do what a nurse does and like what nurses really do every day and what our value is. So I'm glad that you mentioned that because I think that that's important, just important perspective to bring because I think these conversations are like just beginning. And as we've been saying, I think nurses need to be involved rather than just like shutting something down from the start.
Totally. And if you look at like the AI nurse things at the different vendors, all they're doing is like medication teaching or medication reconciliation or basic, chatbot functionality around a disease state or a discharge instruction or something. Like they're not actually
Mhm.
doing anything. Like if you think what a nurse does every single day, like AI is not going to be starting the pump. It's not going to be putting in central lines. It's not going to be managing 15 drips on a roto bed. Like it's not going to do that. And so I think we have to just sort of not react and dig under the hood and then also advocate for, registered nurse is a protected title in all states. And so we have to push back and say that's actually not an AI nurse. You can't call it that. And
Mhm.
sort of use our voice to sort of change the language there too.
Yeah, absolutely. Okay, so you're involved in nursing education. Like from that perspective, what do you think is crucial in how we are preparing these next generations of nurses for what's possible and like healthcare innovation and just like what their nursing career can mean?
Yeah. So my quote I use all the time is nowhere in nursing school do they teach you how to take machine generated insights and turn it into clinical decision making. And I think that's our biggest gap in nursing education right now. And I know a lot of nursing students are like, well, I want to go get my clinicals and I want to start 25 IVs and I want to do these tasks. That's easy. That's easy to train. That's easy to learn. But understanding when to accept the recommendation from an AI agent or to question it, that is way more important. And I think that's really what's missing. And we teach evidence based practice. Evidence based practice is a 15-year-old thing. It takes 15 years to take evidence and get it into practice. Now with AI, it can be in a minute. And so I think we have to really look at how do we teach technology enabled care, not just the same thing that we've done since Florence Nightingale. And I think that's really important. And when I talk to educators, I talk to practice, I run our new grad program at our organization. That's a big gap for them. They're comfortable with technology, but the integration of it into the nursing process is not comfortable. And I think we
Mm,
could do a much better job of ensuring that's a core competency of our nurses moving forward.
yeah, definitely. And what about like how nurses think about their career and what that can be? Because I think that when I graduated nursing school, nursing equaled working at the bedside, hands-on with my patients. Or, you're going to healthcare administration, CRNA, NP, like those are kind of like the paths. It was never really clear to me that like, I could do all of the things that, guests on this podcast do. Like there's a
Mhm.
whole world out there for nurses. So how do we start changing how that's presented to nurses?
Yeah, I mean, I think we can learn a lot from our physician colleagues in this space. If you go to Stanford Medicine, I don't know what the statistic is, but it's most likely you're not going to practice. Like you're going to go start a company, and that's totally fine, right? Like you get your MD degree and you go off and you start a company or do some big tech thing or invention or whatever it is. Nursing school, it's like no, you have to go to med surge, and just like I did, you have to go to the next thing, and then there's like this big built-in cultural linear piece to the career, and then if you ever want to step out of that line, well, no, how dare they? They don't have 5 years
Mhm.
experience to go do that, and we, like, put these oppressive things on ourselves, and it's all BS. Like, I started as a new grad in the ER. You know how many people told me no one could ever start in the ER? I was successful. I got certified within the first year of my thing. They were like, "Oh, that takes 4 years." We can break beyond the bonds of what people think we can do, and so I
Mhm.
think just making it okay to say, "I'm gonna go through nursing school," and I actually don't wanna see patients all the time. I wanna go use that knowledge to go help school children, or I want to go do help build a tech workflow platform that makes nurses' lives easier. Seeing patients isn't the ultimate of nursing. I mean, it's a huge part of our profession, but that doesn't make you a nurse. What makes you a nurse is your thinking and your context and your ethical obligation to the profession and to the public. And I think just reframing ourselves as thinking that bedside is the ultimate expression of nursing. I think that's an old school sort of viewpoint. And I think we need to take the mindset of nursing is a skill set that can be applied almost to any industry in the world.
Yes. And I think that is like what you just said about it being old school. And like we kind of have put these like oppressive like restrictions on like what nursing means. Like when I was leaving the bedside, like it was almost like a like shameful
Yeah.
thing that
Hmm.
I was like leaving patient care. And I'm like, wait, but that's not fair. Like no other career thinks this way. Like I didn't like go to nursing school and like take an oath that I'm going to be like direct hands-on patient care. Like it makes perfect sense to me that like my life is going to change. Like
Hmm.
I'm going to have different priorities at different chapters in my life. And like, it makes sense to me that my career might shift to like support that or allow me to chase down a passion or a new interest or like whatever it is. But for some reason, like in nursing, it was like, I don't know, you're like a little bit lesser than if like you're not
Yep.
going to continue working 12-hour shifts and night shifts at the bedside for ever.
Yep. No, totally. And it's really frustrating. And we still do it. Like, with our new grads, they come out and they're like, oh, well, I'm going to do my 1 year in this one unit and then I'm going to move on to something else. So I was like, if you force me to work it, I originally interviewed for a neuro ICU job and got it at UCLA before the ER called me 2 weeks later and they didn't know. And they're like, hey, you should come work the ER. If I would have stayed in neuro ICU, that's just not where my passion is. Like I would have
Mhm.
probably left the profession. And yet we force our nursing students to go into these sort of pathways that just don't speak to what they're excited about or where their skill set is. And I think that sets us up for failure. And that's why, you have all these statistics of people wanting to leave the profession or turn over after the first year, all that kind of stuff. I think we really have an opportunity to reframe that. And we don't have to, Florence was great, but she was in 18, whatever, 25 in the Crimean War. We're like, 2025 now. There's new world. We can do different things differently.
Yes. Yes, absolutely. And okay, so what do you think like if nurses want to be a part of this like kind of like modern nurse transition where we are involved in the conversations regarding like AI and like new technologies and we see our career as this like much broader thing where we can have impact in different ways. Like what are some skills that nurses can like work on developing to like set them up for success or even skills that they might already be using at the bedside but maybe just like need to tune in a little bit more to like how those can transfer into different types of things.
Yeah, I think getting involved beyond your organization is critical. And so joining things like your local AON, chapter or AONL chapter or whatever it is, the leadership chapter, your specialty organization, and going to at least one of those conferences will just open your eyes to all of the amazing things happening in healthcare. Even if just walking through the vendor space in those conferences, it blows your mind. Like, I didn't know there are companies that did this kind of stuff and they have nurses working for them, and start talking to those sort of salespeople and the nurses, the clinical people that are there. That just will open your eyes to what's possible. And they'll all have ways to get involved in that work. So I think just you got to expose yourself beyond doing your 12 hours and going home and then looking, doom scrolling on Instagram. Like you got to get
Mhm.
out into the world. I think the second thing at
Mhm.
the bedside, there's a lot of change projects that happen, especially now in healthcare. And so one of the first ones I got involved with was a pump implementation. They were switching out the pumps. And I got exposed to now how the technology piece works, how we select vendors, how we do the education to train nurses, what the implications of that are, how do we assess the way this implementation works. Like that project, raising your hand and saying, hey, I'll be a part of that. I'll be the super user for that thing. That exposes you to the world outside of your day-to-day work and gets you noticed by your internal organization to say, oh, maybe this is someone we can pull to do a lot of this kind of stuff if that's what's interesting. So honestly, it really is about raising your hand and saying, hey, I'll play here. And for
Mhm.
nurses too, also shared governance. If your organization is going for magnet, you have a shared governance committee, get involved with that too, because that again exposes you to find the things that you can go say yes to.
I'm glad that you mentioned the IV pump project and like kind of signing up for these types of things. Because I think that, like, there's a message there for healthcare administrators and managers because I think that I don't want this doesn't apply to all situations, but I think that historically there have been a lot of situations where nurses have, like, signed up to be on a committee or a part of a project or whatever because it's, like, part of their clinical ladder. If they want
Hmm.
their, like, $5 raise, they need to do X, Y, and Z. They may or may not be truly invested in what they're working on, but I think that the larger issue is that a lot of times because healthcare systems are so complex, there's a lot going on, change is slow. I feel like nurses kind of like identify a problem, can help come up with a solution, but then never see it actually like implemented. And
Yeah.
that's like, ooh, like I don't know, like why do I want to sign up to do that again? Like they don't
Hmm.
actually value what I have to say here. So I think that there's a message for administrators there on like what that can do for like really just tapping into the workforce that they have and even retaining them to like really recognize the value in like those nurses who are raising their hand to say like, yes, let me work on this, and like really valuing their input.
Hmm. Yeah, well, and there's some research out there too that says that nurse managers are the number one barrier to innovation in a health system. And it's
Hmm.
not because they hate nurses. This is not a us versus them. In fact, we need to get rid of that whole like thing
Hmm.
too. But they're there to maintain the status quo. Like the day-to-day operations doesn't require innovation usually, and so they're not incented to do anything different. And so a lot of nurses will go to their manager and say, "Have this great idea. Like, hey, can we do it?" The manager's like, "I don't know how to make that happen." Like, so no, we're not going to do it. You're going to disrupt our day. Like, we can't do it.
Yeah.
And it's not the fault of the managers. It's not their job. So I think we have to, as nurse leaders and as nurses with ideas, don't take that first no as the no. You got to start kind of navigating the network. Well, okay, my manager
Hmm.
said no, but maybe if I go talk to the director, or maybe I go talk to like my charge nurse about it, like now I've gotten some groundswell to kind of move it through the organization. I think we have to own that and not just blame people on the first no. I see a lot of that on LinkedIn too and on social. But to take that no is okay. What didn't I communicate? Now it's my problem. How do I make this better? This pitch better? How do I make this idea better? Or where else can I try it and bring it back with some evidence that let me move it forward? So own that piece of it. And I think the more you do that, the better. And just don't work. The hierarchical leadership in a healthcare system is not set up for innovation. You're going to have to really build relationships with a lot of different people that you work with to sort of figure out how you can shepherd these ideas into reality.
Hmm. I love that message of ownership. I think that is so huge. And really, what you just said circles back to what we talked about at the very beginning of like your career path and just kind of like pushing forward and having like confidence to like, go and do this thing. So I think that's an awesome message. To wrap us up here, do you have any like advice beyond what you've already given? Like, for example, I think that like the raising your hand, getting involved in nursing organizations, like those are two very like tactical things that nurses can go and do. Like, if a nurse is listening and they're feeling kind of like stuck or burnt out or like their passion or interests have been stifled, like what advice do you have for them? What things can they start doing or thinking about?
Yeah, I mean, there's a ton of great podcasts out there to just start listening to other stories. And so I think that's one is just like who's doing stuff that's in my interest area and let's go at least just exposing myself to that. I found a lot of value on social media, reaching out to people that are doing things I wanted to do and saying, "How'd you get here?" Even if they don't
Mhm.
want to take your call, you usually get at least a response or something, or even a 30-minute little chat about what's going on. So do that research. And then, I think it's really about putting your ideas out there in some way, whether that's on social media or some other way, and saying, "This is what I'm really interested in. Does anyone know someone that can do that?" I mean, the networking piece, I don't think can be understated. It's been so valuable. I know a
Mhm.
lot of nurses are on Instagram and stuff, but I find that there's a ton of value in LinkedIn because that's where the hiring managers are. And so, being able to transition to start talking about what you want on different platforms, I think can get you exposure to and just reach out. I mean, I have reach outs every single day from people. How do you get here? What can I do? Hey, what do you think about this? I respond to most people about that kind of stuff. You'll be surprised the information you can get and the pathways and doors that open.
Mhm. I love that. Don't be shy. I
Yeah.
think that could be a kind of intimidating thing because we don't network
Hmm.
in nursing, really, not at like the bedside level. So, reaching out to somebody and saying, "Hey, we don't know each other, but I'm really interested in like what you're doing or how you got here. Like, can we get on a 30-minute call?" Feels like this totally foreign thing, but
Yeah.
I totally am with you, and that networking effect is so powerful.
Well, and join like it's less intimidating if you go to your state organization too, like ANA California. It's all the people you work with. It's your
Mhm.
friends. It's in your state. They have the same like communities or so start local too. There's a lot of great things. And there's some really awesome organizations out there in nursing that are non-traditional, like the National Black Nurses Association and DNPs of color and these innovation ones. Like there's some really cool organizations out there that welcome everybody, regardless of your background, race, color, everything. Like go play with them because they're cutting edge. They have these awesome networks. They're moving and shaking, and that might be more comfortable than thinking about some of the traditional ones right off the bat.
If you'd like to connect with Dan after today's show, you can find him on LinkedIn or visit his website at drnursedan.com. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, sign up for my free newsletter at mypivotpath.com. Get non-bedside jobs delivered to your inbox every week. And if you have questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and until next time.